This is the third Headless Professor video on the topic of causal analysis. Notice the spelling of the term causal, C-A-U-S-A-L. It's not spelled the same way as casual. Now, a cause is an influence upon another event. Usually in science, we regard this as the independent variable. And an effect is the outcome, the event that is influenced by other causes. And in science, we regard this as the dependent variable. One advanced form of causal analysis takes a look at 4 different roles that causes may have with respect to an effect. A cause may be predisposing, paving the way for the eventual effect. A cause may be principal, the major factor, essential to bringing about the effect. A cause can be precipitating, something that triggers the effect. Or a cause may be perpetuating, coming after the effect, perhaps as a result of the effect, but nevertheless reinforcing that effect, keeping it going. Let's take the example of an explosion. The explosion would be the effect. Now, the predisposing cause might be the dry air. The principal cause might be the explosive material, the dynamite, which has been accumulated. That's the most important factor, the essential feature for the explosion to take place. The precipitating cause might be a little spark. In and of itself, that spark is not going to be a problem. But on top of that principal cause, all the dynamite that's there, that can trigger the effect of the explosion. Now, once the explosion takes place, perhaps that explosion sets off some other explosions in a gasoline refinery close by, and that perpetuates the explosions going on. Let's take another example from mental health. Most mental disorders can be viewed as an effect which has resulted from a conglomeration of predisposing, principal, precipitating, and perpetuating causes. Let's take one of the most complex mental disorders, that of unipolar depression. The predisposing cause for depression may be genetic. Certain people inherit certain genes that make them more likely to have a depressive metabolism. And this is true of unipolar, but not quite as true as it is for something like bipolar disorder. Another predisposing cause might be bad things occurring in the childhood, especially the loss of a parent due to death. These make the individual more vulnerable, more susceptible to depression, but they are neither adequate nor essential for adult depressive disorder. The principal cause, I would say, is something in the individual's personality, the way that that individual uses certain cognitive schema, whether that person has a tendency to engage in learned helplessness. What about the precipitating cause? What's going to determine if an individual who has a depressive personality is actually going to have a major depressive event? Well, there may be a precipitating factor. Now, this is not going to be essential and would certainly not be adequate. But if you have a precipitating loss, such as the death of a loved one, loss of a job, loss of a relationship, any of these things could trigger the onset of bereavement, and that could create a kind of severe depression. Now, once an individual goes into a depression, there are a number of perpetuating factors. The individual will probably reduce his level of activity. And with less physical activity, that will intensify the depression. The person will also probably withdraw from social activity and receive less social reinforcement for interaction with friends. That also will intensify the depression. So each one of these factors contributes something to the overall depression. That's how this advanced causal analysis can understand a complex phenomenon.